Hi, this is Rob Gosling from Select Dental in Exmouth. I just wanted to post this really just to try and help our patients and also anybody else that could be watching this or maybe in trouble with dental pain. I just wanted to talk to you about how to manage your dental pain when we can't help. Last week, NHS England, Department of Health and our regulatory bodies have told us that we can no longer actually see patients face to face. But what we are able to do, we are able to talk to you to help you manage dental pain. So please give the practice a call, or my personal mobile is 0781 492 0136. So if anything worries you, please give us a shout. We can talk to you on the phone, we can guide you, painkillers. If necessary at this moment in time, we can actually prescribe antibiotics. It seems by maybe the middle to end of next week, kind of 7th, 8th of April, it's looking as though there's going to be emergency buildings set up at Exeter, Torbay, Plymouth are being discussed, where people with serious dental pain we can refer to. But at this moment in time, we have nothing. So I just wanted to talk to you a bit really about what's urgent and what's non-urgent. So if you have any facial swelling, or perhaps you've actually knocked a tooth out and it's bleeding heavily and you're in pain and again swelling, we do need to talk to you, so please give us a call and we can advise you further with antibiotics. Anything really urgent, I would say, is facial swelling, heat in the cheeks, pain that's keeping you up at night, and pain that is, not being controlled by normal things, paracetamol, ibuprofen, and so on. Chances are we would probably at that point refer you straight into accident and emergency, because that is what I would absolutely classify as a dental emergency, and where we've all got to be very careful at this point in time is not getting infections in our mouth, which can obviously lead to sepsis and much more serious things. So if you've got bad toothache, but there's no swelling, what we generally suggest is using basically over-the-counter medication. Paracetamol, on average, it's 1,000 milligrams every 4 hours, but please read the instructions. Please look at your current medication you may or may not be taking to make sure nothing's going to interfere with that. Ibuprofen, again, can be very good. So what you can do is every 2 hours, take the paracetamol, and then 2 hours later, take 400 milligrams of ibuprofen. Again, be very careful this doesn't influence any other medication you're taking, because ibuprofen can cause tummy upsets. The guidelines we're working to at the moment is if you are showing any of the symptoms of the coronavirus, COVID-19, is not to take ibuprofen. So please, again, call for further advice if needed, but just watch any other medications you're taking. And if necessary, speak to your dentist. So that should put at bay the toothache. But again, if you're worried, please give us a call. So non-urgent cases that, probably are more manageable, as I say, is general toothache, as long as, again, there's no swelling. Ulcers in the mouth can be a bit of an issue. That's whether we wear dentures, sometimes if we're wearing orthodontic appliances. So again, if for ulcers, Difflam, which you can get in a spray in the chemist, is very good. Cortisol mouthwash, again, very good. And funnily enough, even the lightly salted mouthwash with warm water. Roughly 1/4 teaspoon of salt, a couple of inches of lukewarm water, and again, that can make things a lot better for you. Denture-wise, denture ulcers are very common. It's maybe not a nice thing to do, but if it's a bad ulcer, remove the dentures for as long as you can. If you notice any sharp edges on the dentures, you can use an emery board just to smooth them over a little bit. And again, go for the Difflam, Cortisol, or lightly salted mouthwash. Sensitive teeth, definitely not an urgent issue, but nonetheless can be very painful. You can get a sensitive type toothpaste, Sensodyne do one, Colgate do one as well. Brush your teeth twice a day with this. And also, when you finish brushing your teeth and you've in effect, spat into the sink, do get a blob of the toothpaste, a sensitive toothpaste, on your finger and rub it all over your actual teeth themselves. And at this time, do not rinse. You actually want that toothpaste to stay on the tooth, and that will then help absorb it all. Problems with wisdom teeth, that can generally be managed. Make sure you brush the area well. It might hurt, but please keep brushing it well, again with a sensitive toothpaste. Once again, if the gums are inflamed, cortisol mouthwash is very good. Bleeding gums, not a denture emergency, generally a sign of gum disease. That will generally get better if you improve your brushing. So once again, 2 to 3 times a day. Don't worry if you see blood. That means that the body is in effect getting rid of the bacteria that sits up and underneath the gum line. So basically keep brushing. Cortisol mouthwash, again, not a bad idea, but with any cortisol mouthwash, make sure you only do it for a week, no more than that. So hopefully that's bit of advice is going to get people over the emergencies until they can get back to their dentist, or get back to us. You know, we've got many thousands of patients. I'm taking many calls every day where I'm literally giving the advice that I've just said, purely because we can't see people. And probably on a personal note, and I'm sure I'm as guilty as anybody else, this horrible current situation has showed me actually how important our teeth are and how horrible it is when things aren't right and you can't get help from anyone. So please, all of us, I can only speak of dental problems. When we're out of this, get your teeth checked, because tooth pain is horrible. It's really horrible. But I wish you all the best. I wish you all stay safe. I've given you my mobile number. Any questions, any concerns, please, I'm at the end of the telephone. I wish you all the best. Thank you.